creating therapeutic relationships. What does this mean? And specifically, how do our 7-figure practices absolutely dominate the patient journey and the patient experience? Again, our patient journey, what we want to focus on in taking you from a 6-figure clinic to a 7-figure clinic is not just the conversations and the quality of those conversations, but the quality of the relationships that you're creating, the patients that you're engaging with. This all has a vital outcome on how many patients you're going to close, what the value of that patient is going to be over the lifetime of their experience with your practice, how they're going to refer you to other individuals in their family and network, and ultimately your success. So again, let's visit the new patient mindset. Patients that are going to come to your practice not based on a referral process are probably just clicking on an ad for the very first time. They're going to be nervous. They're skeptical of the healthcare system. They probably have very limited knowledge of your practice or the treatment options that you present, but they are looking for help. They are looking for a practice that they can trust, that a group of individuals and professionals that they can value. But what this helps us focus on is this is why we need to focus on creating essential relationships, or what we often call as clinicians, the therapeutic relationship. So when I talk about the therapeutic relationship, what am I speaking specifically on? Because this may be a new topic to some individuals, it may be something they haven't heard in a long period of time, but it's traditionally referred to the relationship between a patient and a caregiver. So myself as a nurse, one of the doctors, a nurse practitioner, a physiotherapist, or a chiropractor. But it's adapted and integrated into conversational marketing, which is what we specialize in. So in the outpatient setting, our research demonstrates that this relationship guides the decisions of the patients. We shouldn't be shocked by that. And the front desk staff person can create a therapeutic relationship. Obviously, we're going to focus on it as clinicians as the main strength of our practice, but it includes all the social connection that the patient engages with us in. It includes the trust, the respect, the empathy that we show to them for the problem that they're currently experiencing, and the knowledge that they need and the education that we provide to them through the entire consult process. Our research shows some really interesting things here, though. So it does confirm that patients are seeking to develop a therapeutic relationship over approximately 30 to 70 minutes. And that does seem like a long time. It's something that each of us battle depending on the offer that we're presenting, how we have flow through our clinic. And most clinicians honestly don't have 70 minutes to spend, start to finish with a brand new patient. But what is important to understand is that relationship for a patient is essential before they're going to commit to a decision. So when we present a treatment plan to a patient or we offer them treatment options, we shouldn't be shocked if we've only spent 15 or 20 minutes with them, because what research is telling us is that's not a long enough period of time for a patient to feel compelled to act. And that time, again, can be something where, we'll get into this in a moment, but we use systems for our practices to use this to our advantage. So if the front desk is spending approximately 6 to 10 minutes on a really good call, using our script, creating that rapport, using gratitude, making the patient feel valued, well, what we're actually doing in that instance is we're taking time off of that 30 to 70 minutes and giving that asset to our provider, our physician, our nurse practitioner, our clinician. If we spend 10 minutes during a tour, again, an engagement with the patient, asking them, we're so happy that you came in, what made you decide to do this now? All of that, again, chips away at that time that is required. If we conduct a pre-assessment with a nurse or treatment coordinator or an assistant at the office, again, that patient is spending time with our practice. The patient is spending time getting comfortable. They're developing that know, like, and trust. So ultimately, in a perfect world, if they can see that physician or that consultant for a 30-minute assessment, then at this point in time, we're maximizing the provider's time, but we've kind of chipped pretty significantly away at that time that is required for that patient to feel that it's their decision, that this is comfortable for them, that this is the right move for them moving forward. So why aren't our patients showing up? Well, the majority of the time it's because we're not creating the relationships that are needed for them to show. So stats and rates, about 24 to 34% of outpatient appointments are going to not be attended. That's a fairly well-published paper. And automated patient reminders are worth a lot, and that's why we use them to our advantage. They continue to grow year after year. This is a large study that was done just under 1.1 million patients. They looked at all the different reasons why patients didn't show up. clearly what we saw is the number one reason why patients don't show up is because they've got a prior no-show. But it's not really appropriate for us to ask that to a patient the first time that they're booking with our clinic. So sometimes that's to a disadvantage for ours. But again, there's a big gap. Not all of that adds up to 100%. So we've always wondered to ourselves, is it largely relationship-based? That patient isn't feeling confident, but not feeling like it's worth their time. And the script that we're going to give to each of the clinics is going to maximize on that opportunity to be able to decrease no-shows. We're never going to get rid of them completely, but what we do want to do is make sure that the most number of patients show up possible. So the literature shows that best practice for reminders, and so what we're going to encourage your practice to do, is a reminder at 48 hours, a reminder at 24 hours, and a reminder at 2 hours. And regardless of age or gender or specialty, this is the best practice model. So our automations inside of our system are going to send them an email and text message at 48 hours, but we still need you to call. We're also going to send them an email and a text notification at 24 hours and 2 hours with the map to your location, but we still need you to call at 24 hours. So again, we know that past behavior is the most predictive, but we're not going to be able to ask that question. And what's interesting is there's no peer-reviewed research right now on the messaging that goes up to patients. So you'll see us take a very conversational approach in that messaging. We'll ask you for a video. Sometimes we'll send images. But what we're looking for is what is the best outcome that we can do to drive in each specific clinic in each specific market to get the highest show rate. So again, let's talk about therapeutic relationships because this is a lot of high level, stuff, but let's bring it down to what I think most of you inside the practice can identify with. So let's meet Deb. Deb never has a bad day. This is a secretary, medical secretary, or staff member of the practice that every one of us has interacted with at some point. Every time that you call her or you call the office, you're hoping that she answers. You're pretty convinced that she poops rainbows in the morning because she's just that happy, chipper, warm person. She's quite possibly the most favorite person that you have in the world. And you always feel that she knows and she cares. And this is the image, the persona, the feeling that we want to give to the patient before they come in. If we give them anything other than this, then honestly, they're looking at your clinic just like every other clinic they've interacted with, every other clinic that they've evaluated for their problem, and they're not going to show up. They're not going to book an appointment. They're probably not going to answer the call back from you. Again, let's contrast this. Tara, she's a little spicy. She's the guardian of the calendar. She's this, she also works in the office, but she's all business and no chit-chat. The glass at the front desk is only ever open half an inch. She's actually rarely actively listening to the patients. And again, Tara's very, very good at her job, but the impression that she portrays to the patients is completely different. And what we need to understand is this type of messaging, verbal or nonverbal, to the patients is not going to improve our show rate. It's not going to make the patients feel like they're welcome and that they're interested in coming in. The Deb approach again, contrast this. Deb's always the person that answers every call within 3 rings. So she's dependable. You know that you're going to be able to reach her. Consult requests come in, they're booked, they're called. Fantastic. She's always thanking you on the call. She's using gratitude, right? Saying, hey, thanks so much for calling. Really meant a lot to us that you reached out to us today. And she always ensures that you have all of the instructions, the directions, what to expect for the appointment. If we again contrast that to Tara again is very, very good at her job, but doctor offices phone calls are answered more often than actual patients. She's going to let it ring for the answering service. She probably only books out of the consult binder on a Friday. She's very polite, but she's curt. And she doesn't give you that warm and fuzzy feeling. And, she's going to tell you that she's going to send you all the information that you need, but there's that little bit of hesitation on the patient side of, am I really going to get that information? And again, it's because of that lack of warmth and empathy and energy and everything else that we want to portray. So if we kind of put these two head to head as a comparison, the reminders that we don't want to send are on the side here with, this example, right? A reminder your appointment is scheduled for Monday at 9 a.m. with Dr. Johnson's office. That's something that either would come automated or would come from Tara. Messages we like to say is what we would say exactly from Deb, or in our case, the AI persona of Kate. It's Deb, friendly reminder that we're looking forward to seeing you for your free screening in about 2 hours. Here's an app to our office. Whether that's automated or not, it's going to give the patient the impression that, wow, you care about me, you took the time out of the day. This really means a lot to me. I hope this was helpful. Again, let's focus on this. In our Q&A sessions, we will role play. We'll talk a little bit more about the application of it. But But we do need every single one of the practices to focus on maximizing the therapeutic relationship to be able to drive the most financial outcome at your practice.